Hi, welcome back. I'm your host, Barry Waxler. We are here with our next guest, Mr. Kiyan Mehdizadeh from Floss Dental Group in La Jolla, correct?
Yes. Good
Great,
morning. It's a pleasure being here.
great. So tell us a little bit about your dental group. What is your practice like? Tell us a little bit more.
Well, when I built this practice, I opened it very recently. It's been open about only 4 months. I decided to go against the grain, which is when you go to industry meetings, the trend everybody talks about is further consolidation, larger practices, doing efficiency. People are running offices like they're corporations. And I didn't like what I was seeing.
A lot of sales and marketing, or
Correct. A lot of sales and marketing and a lot of efficiencies, as in shaving off time and procedures, cutting on supplies, wherever you can get a little bit more marginal return. And that's not a healthcare practice. That's a corporation that you're running. And I didn't like what I was seeing in dentistry. So I decided to go completely against the grain and go back to the basics and do dentistry the way your grandparents experienced it, which is one-on-one with the dentist. There's no sales
but
pitch.
using modern technology, because
Oh, hopefully.
yeah,
Yeah.
I remember all the stories my dad used to tell me. He's 93 years old, bless his heart.
Aw.
And he used to tell me about going into the dentist's office and seeing all the teeth all over the floor. And I said,
Ah!
that's more information than I wanted.
No,
Well,
no.
that's the way they used to do it in old school Philly.
Yeah.
I don't know that they did that everywhere, right?
Yeah, well, that wasn't the dentist's office, I guess, with all the teeth around. That was South Philly itself.
Well, Floss is an absolutely modern and fresh take on dentistry. As far as technology is concerned, we're state of the art. The equipment, for example, our X-ray machine emits so little radiation you don't even need a lead vest for it anymore.
Oh, wow.
We do the latest technology. We place implants, IV sedation, everything's done in the office. We provide the full complement of services. What I was talking about with regard to the 1950s approach, it's an attitude,
Right.
not the actual technology or the treatment. And I think the attitude of taking care of people is being lost more and more in healthcare. And so under this new model, it's only the entire treatment is one-on-one. There are no people coming into the room giving you sales pitches. The doctor isn't dancing around the issue or not, being evasive about cost, anything like that. What I'm trying to introduce is transparency again. And so you can have buy-in into your treatment. You can be excited about your treatment. So there's no sales pitch. Nothing is being pushed on you.
So you're not when I come into your office to have a teeth cleaning, you're going to do the work, and you're not going to have a hygienist. You're not going to have an assembly line waiting for me.
No, absolutely. So you come in, we greet you. Before we even do anything, we take tons of pictures. In our practice, we take about 3,000 pictures a month. And these aren't little
Wow.
pictures. These are
Wow.
HD 20 megapixel pictures. We throw them up on the screen and we go through what I call a tour of your mouth. We show reality views. So once we're done with this 20-minute conversation, you know what the reality is in your mouth. And then we ask you, what your thoughts are, what your feelings are, what your goals are. From there, we go on to your treatment. If you just want a cleaning, we're more than happy to do that, and I do it myself.
Right.
Wow. So is everybody's teeth going to look as gorgeous as yours? Don't you love seeing a dentist with choppers like that? I mean,
Well,
gorgeous.
Well, the beauty of Floss is that's one of our goals is that we want to under our practice model we've cut our overhead so much and we've cut so much waste that we can open cosmetic dentistry to a whole new slew of people.
Now, cosmetic dentistry meaning whitening? What do you mean by cosmetic dentistry?
Well, people always think cosmetic dentistry is veneers and whitening, but that's not true. In biology, form and function go together. So what is healthy is also proportional and beautiful. So when I'm talking about cosmetic dentistry, I'm talking about restoring your health and proportion. And that's also what's going to make it beautiful. We don't just focus on making you beautiful. But yeah, that could include veneers. It could include sometimes just deep cleaning, a little bleaching, bonding. There's a full complement that we can do. Implants, anything.
Yeah. You know what this reminds me of is a little bit of Dr. C from Spark Health.
Yeah.
Because what she does is she'll spend hours with you when, I'll go
Instead of
into my
15 minutes with
GP
it, yeah.
and 15 minutes and how fast can I get you out the door? So that's great. So you have a state-of-the-art technology and you do it one-on-one. There's not an assembly line of people there.
It's absolutely back to basics. So, for example, when you come in, I'll sit there and I will talk with you nonstop an hour and a half before you even do anything because I want us to be on the same page.
Right.
And I want you to have buy-in into your treatment instead of me just saying you need to have these things done and at the end you resent me for it because you need to have so much work done. That's not what it's about. It's finding out what your goals are. And that's a conversation. You have to sometimes pull it out of people.
Right.
And then once you get that, I'll show you how you can get there. Now, what's really interesting is in our office, we only see one patient at a time. So when you come in, you can put your purse in the reception room. There's nobody else coming in. So the whole office is yours. It's beautiful, light-filled, spacious. But when you're sitting in that office, you're the only one. And I've noticed that when you know you're the only one, the candor that you have in that conversation with us is completely different. So people really pour their heart out and they say, oh no, this has been bothering me. This is what I'm doing. And it really amazes me how people open up when it's just one-on-one. It's a completely different dynamic.
It probably takes a lot of the anxiety that so many people have about going to the dentist. I know most of my friends, people I know, just the dentist is the last thing they go to, and it's so key to health. I mean, dentists today are diagnosing so many illnesses or potential, like diabetes as an example. Dentists they're the first ones that many people hear from that go check and see if you have diabetes or something. It's the mouth really reveals so much about our health.
That is absolutely true.
Interesting. You're listening to Close Up on San Diego Business here on KFSD AM 1450 and financialnewsandtalk.com. I'm your host, Barry Waxler, here with my co-host, Andrea Kay and Urban Miaris, and our guest is Kiyan Mehdizadeh from Floss Dental Group. So
one of the things that's really hot that is we're seeing in commercials all the time is implants, number one, and same-day implants, number two. First of all, if you could maybe, for those who don't even know what an implant is, describe what is an implant and why you were explaining to me prior to the show why maybe same-day implants isn't the best way to go.
Well, first of all, it depends on the person doing it. If some surgeons are very well trained at doing this, but so let me explain to you what a dental implant is. All it is, it's a special titanium alloy. It's a screw that we place inside the bone, and it replaces the roots of missing teeth. And on that, you can use it as an anchor to put a prosthesis, which would be one tooth or multiple teeth, or it could be all your teeth. Now, the problem with something like that is generally when you're really aggressive with any kind of medical treatment, I think you get poorer results. You have to respect the biology. And so, yeah, you can place implants in one day, but it takes 4 months for an implant to heal. So
because of the bone? It's
correct. So you're not in pain, but when we place the implant on a microscopic level, the bone grows into the implant and it becomes part of your body. So during this 4 months that you're chewing on this and you're moving this implant, it's not going to heal as well. And that's just biology. You have to respect the biology. So there are a lot of treatments out there, but generally speaking, what is most prudent is, the slow and steady approach. Teeth in a day is wonderful depending on the condition you're in. But generally, it might be better to take kind of a slower approach, a more holistic approach.
Interesting.
Now, you're one of the younger dentists in town doing this type of work, correct?
Yes.
Tell us about that.
Well, so when I was in dental school, I started going to continuing education courses. And what continuing education is, it's usually for older dentists to kind of become updated on their technology so they can keep their licensure. But I started going while I was still in dental school, because in continuing education courses, if you find the good people, the people that are the best in their field, they will demonstrate to you the absolute state of the art. And what made me sad in these courses is that you see dentists that have been practicing for 30, 40 years. They come in and at the end of the course, they say, wow, this was wonderful. I can go do this to my patients. Why haven't I been doing this whole time? And I think to myself, why haven't you been doing this whole time? So I'm sure you've been a wonderful dentist, but for the last 30 years, you've been not doing as much of a good treatment. So what I decided is right out of dental school, I went and found the best people in the field of certain treatments. Full mouth reconstruction, implants, sedation, etc. And I went and I trained with them because I figured, why wait 10 years, 20 years into my practice before I up my game? Let's just hit the road running. And so I'm pretty much the only dentist in San Diego in my age group that has the training to do these large cosmetic reconstructions that we do at Floss.
Well, one of the things we talked about before we got on air that I resonate with is you talk about building value, and that's a lot of what I do with my clients is it's all a value-based proposition. If you create value, then everything else will fall in place. And that sounds a lot like what you're doing is you have a value-based proposition. You have the quality of service, you have the care, and you've made the sacrifices to keep the overhead down. Rather than have a nice, easy, cush job to have everybody doing all the work for you.
That's absolutely true. In some practices, you'll see there's one dentist and there's 7 staff members. You have to consider that these staff members, somebody's paying salary for them, and it's the patient that's paying for it. So if we make our schedule slower, it'll actually be easier because I can spend more time with the patient. There isn't as much rush, but then I also don't need all these staff members to support our schedule, so I can pass the savings on to people. So this is how we're spreading cosmetic dentistry to a whole new slew of people that would otherwise be priced out of it, which I think is unfortunate.
Well, we're starting to run a little bit short on time, so tell our listeners if they want to find out more, learn more about you, or set up a time to come see you, how do they get a hold of you?
Well, the best way to find it, you can just Google us online, but the best way to find us is at www.flossinlajolla.com, or they can look us up on Yelp or social media. We're very active on Instagram, and we post photos of any interesting cases or just, the office puppy or something fun that happens in the office. And our Instagram is Floss in La Jolla.
Great.
Yeah.
So
we can't. We got to make sure everybody knows about Remy.
Oh yeah, Remy. We have an office puppy. She's a cute little Yorkie that always has a summer cut.
So,
and she's the patient greeter.
Yeah, and I heard you traded in your TV screens for Remy, right?
For the puppy, yes. So when people have anxiety, for example, when we're doing a root canal, she'll actually sit on the patient's stomach or their chest, and they'll pet her and play with her. And people are responding to her much better than I thought.
That's better than any anesthesia or laughing gas, in my opinion.
Yeah. So, and if somebody wants to set up an appointment to come in and visit you, what's the phone number?
It's 858-597-9844, and we do complimentary consultations on all cosmetic work.
Okay. And you're just over on Executive Drive in La Jolla, correct?
Correct. Right across from the UTC Mall.
Perfect. Wonderful. Well, I want to thank you for coming. Our sponsors, Spark Health and Sombrero Mexican Food, have a little gift for you. Appreciate you coming. Give them a call too, and we will follow your story as it grows.
Yeah.
Thank you. It was a pleasure.
Wonderful.
Thank you for coming in.
You're listening to Close Up on San Diego Business, where we get up close and personal with San Diego businesses and the people that are working hard to make a difference in our community. This is financialnewsandtalk.com. I'm your host, Barry Waxler. We'll be right back after the break with more homegrown business Close Up, and we're going to cross over to the nonprofit sector with a wonderful charity called Promises to Kids.